All right, Dagwood. So this is the your medicine cabinet, correct?
Yeah.
All right. How long have you been a Prop 215 patient and enjoying the benefits of it, brother?
Oh, and I think about 2001 or whenever I started seeing a doctor up in Santa Cruz who's a physiatrist. He's a spinal cord rehab specialist.
Right.
Basically means you got to do another 8 years of school after you do your normal 8 years of school for being a doctor.
Right.
And at that point in time, he basically said, "Do you want the paperwork?"
You okay? Are you okay?
Yes, I am.
Okay.
Just set that behind me or away. And at that point in time, he just came up and said, "Do you want the paperwork?" And I said, "For what?" And he said, "For, marijuana." I said, "Absolutely." He said,
What paperwork?
He said, "Most quads do," meaning
Mm-hmm.
quadriplegics.
Mm-hmm.
And so it wasn't a case of me having to chase down any doctor or find any backstreet doctor to make any backstreet deal to do it.
He was a kind, compassionate doctor that understood.
Yeah, he was just essentially, and at that point in time I was...
I'm sorry, Darren, what was his name again?
His name is Dr. Quinn.
Out of Santa Cruz.
Yeah, and again, he's a physiatrist.
Okay.
To see this doctor, you have to break your neck and need spinal cord, not just rehab, but maintenance,
Right.
I should say.
Okay, well that's good because we have a lot of Central Coast medical patients that might be able to benefit from that information.
Yeah.
Wow. And then, so once you got your recommendation, what was your startup process? How did you, based on the neighborhood that you find yourself in, how did you choose to situate yourself, and how do you feel from a security standpoint? Do your neighbors support what you're doing? Do you fear them? Are there, there must be additional concerns that go along with this.
For the most part, it's kind of just been at first, before I got myself kind of taking care of my own medicine, I relied on friends that donated a lot to me, so I didn't have to worry about.
Right. But I know you. You love gardening as well as anything else. When you're down in Big Sur, you are an awesome gardener, man.
And then once I found a caregiver that worked with me during the day,
right,
that had similar interest.
Wonderful.
Then things just sort of
naturally progressed.
Took off from there. And also at one point in time, I was co-owner in Monterey Bay Horticulture Supply, which was the high-end garden hydroponic store. So that increased my knowledge.
As will soon.
Not necessarily success,
mm-hmm.
but knowledge.
Right.
I knew a whole lot. Know what to do with that knowledge and put it in the right order is a whole other
Sure.
thing.
From an MBA business schooling standpoint, there should be a whole new class on this topic. How to go about business within the medical marijuana business format, because there are additional liabilities, additional costs. There are just unforeseen variables that come into play that don't happen in other businesses that make startup a lot more interesting than necessarily they need be.
If you, up in Oakland, they have a course that you can enroll in.
At Oaksterdam.
And they touch a little bit on everything, but not necessarily enough information on all the topics that